When your period is late, if you are still of the childbearing age group, then the first test that you have to do is the pregnancy blood test. Whether or not you think you could be pregnant, this is the first thing that you have to do. This is the first thing that any doctor will ask you to do. As long as you are sexually active, you have to get a pregnancy blood test done. The next group of tests that you need to do is a bunch of hormonal tests, which I'll talk about in the next part of this video. But if you want to just know the name of the tests for a late period, it is the pregnancy test and the hormonal panel for women. So what is the name of the blood test for pregnancy? It is called the beta HCG blood test. It is only done in labs. You cannot do this at home, and I do not recommend that you do the urine pregnancy test because these have issues with accuracy. You can do the blood test for pregnancy, which is called the beta HCG test. It will only show you a positive result around 2 to 4 weeks after the conception has already happened. So just because you get one negative result on this doesn't mean you're not pregnant. You need to repeat it after at least 2 more weeks. And this is the most accurate test and the earliest positive in case you're pregnant. So if your period is delayed, this is the first test I would recommend that you do. Now, if your period is delayed, there are several other reasons why you could also have a late period, and they are all equally likely. The first out of this that I want you to do is the prolactin blood test. The prolactin blood test will check for the levels of a hormone called prolactin in your blood. This hormone's only job is actually to promote the production of milk in women who have already given birth and are currently breastfeeding their infant. But if the prolactin level rises up a lot in a person who is not pregnant, in a woman who is not pregnant, this causes them to miss their cycles. So this is the next blood test that you have to do. You should provide the sample in the morning around 8 o'clock and you will get the results preferably on the same day. A normal level should be less than 23, and the most common cause of a high prolactin level is a swelling in your brain. The next two tests that I want you to do are the LH test and the testosterone test. These tests together with some of the other tests in this list will tell us whether there are a high level of male hormones in your blood. This is a condition called PCOS, which is called polycystic ovarian syndrome. If the levels of male hormones in your blood are higher than normal, you could miss your cycle or you could have irregular cycles, and this could be the reason why you're noticing this late period. Both these tests will tell us the answer to this. You have to provide your sample only on the third day of your cycle. Do not provide it on any other day. The results don't make any sense on any other day. So if you're going to provide a blood sample, all these tests, provide the sample only on the third day of your cycle, and you can do all the tests from the same sample. The next is two tests called the AMH test and the FSH test. Both these tests are designed to tell us whether there are still enough eggs left in your ovaries for you to conceive. If you are more than 45, it is possible that you have already hit menopause. Menopause occurs when a woman stops ovulating. There are usually no more eggs left to release in the menstrual cycles, and so you start noticing irregular cycles or you may miss your cycle completely. The way to diagnose this is by using the AMH test, which is a blood test, as well as the FSH test, which is also a blood test. Again, you should provide the sample if possible on the third day of your cycle, but you have missed your cycle, so it may be a little confusing. Provide the sample as soon as possible and we can check whether these tests can give us a clue as to whether you've already hit menopause or there aren't enough eggs left in your ovaries, so that is why you're not having the cycles. And the last test that I want you to do is the thyroid test. If your thyroid is not working properly, you might have very irregular periods. This is one of the most common causes especially in younger women who are of the childbearing age group. Their thyroid is not working properly, it is overacting, it is underacting, and that causes these delayed periods. So these are the 1, 2, 3, 4, 5, 6 blood tests that I want you to do. Do them, provide the sample on the third day of your cycle if possible. But because you're here, you probably missed your cycle, so I would recommend you provide the sample as soon as possible. Inform the lab and your doctor about when you had your last cycle so they can correlate it correctly, and definitely consult your doctor before doing anything else.